Hi, I'm Dr. Wendy Mitchell. I'm a physician here at Leahy Clinic, and I work in the Executive Health Department and also the Department of Hospital Medicine.
Cardiovascular disease is the #1 killer in the world. Heart disease causes major health problems and often leads to heart attacks. These life-changing health events do have warning signs and can often be prevented if action is taken.
The symptoms of coronary artery disease classically are described as a chest pressure or pain. Sometimes people will get associated tingling, usually more on the left side, but can also be on the right. People can get palpitations or skipped beats of the heart. They can also feel nausea, vomiting, lightheadedness. In females, they can sometimes have slightly different symptoms. So where classically the chest discomfort is described as a pressure or a squeezing, and also sometimes described as a pain, in females they will sometimes describe it as a burning discomfort in the chest. They may not have a chest discomfort at all and may feel more of a shortness of breath or trouble catching their breath. And sometimes it can be as vague as feeling just weak and tired. The symptoms are often overlooked because they can be very common. Sometimes people are expecting to experience a severe chest pain, but often when you talk to patients, they'll say it's not a pain at all. It can be more of a squeezing sensation or a tightness or a dull pressure in the chest, and that can be misleading at times. And sometimes people may confuse their symptoms with either some heartburn, a muscle pull. It's vague, and people experience the symptoms in different ways. Usually there are warning signs prior to people having a heart attack. The important thing is to recognize those warning signs. Heart disease will become evident when you're exercising generally at a capacity that's higher than normal. We'll commonly see heart attacks when people are shoveling a very heavy snow, which is a little bit more of an exertion for a sedentary person than they normally do. You will experience some chest discomfort of some sort, or what we call angina or an angina equivalent. That will signal that the heart is not getting enough blood flow. It's important to act on that at that time and get that taken care of before the artery completely blocks off. Otherwise, if it completely blocks off, then you will cut off the blood supply to the heart and therefore suffer a heart attack, which is where part of the heart muscle will actually die. If you develop any symptoms, especially when you're exercising and then those symptoms resolve with rest, that would be a red flag that you should seek medical attention right away. If you're having any increase in symptoms over a period of time and things are changing, then again you should contact your provider right away or seek medical attention. The risk factors for developing heart disease, some of those are modifiable and some are not modifiable. Unmodifiable risk factors are your age. The older we are, the more at risk we are for heart disease. Whether you're male or female, males tend to have a higher risk of coronary artery disease. And a family history of premature heart disease. And what I mean by premature is having a first-degree relative, which would be a sibling or a parent that has heart disease in a male less than 50 and in a female less than 60. Modifiable risk factors that you can control, the first thing is smoking. Stopping smoking is the best thing you can do for yourself. Secondly, controlling your blood pressure, cholesterol, and diabetes. Those three medical issues have a significant impact on your likelihood of developing coronary artery disease. And obesity and alcohol also play a role. You should talk to your doctor about your risk factors for heart disease and have your doctor tell you if you're at high risk for heart disease or if you don't have a lot of risk factors for heart disease. The more risk factors you have, the more concerned we are about any symptoms you might be having.
The heart has a big job to do, constantly pumping blood and oxygen throughout the body. The heart beats around 100,000 times every day. To keep the heart running, it's important all the veins and arteries in the body are free from any obstructions. A traffic jam in the blood vessels can lead to a heart attack.
The heart is basically a pump, and its job is to pump blood and oxygen and deliver it to the rest of the body. The heart itself, because it's a live tissue, also needs blood. And there's special arteries that deliver the blood flow and the oxygen to the heart muscle itself. And those are called coronary arteries. What happens with people with atherosclerosis or blockage of the arteries is that they will have plaque buildup in the arteries. Plaque is basically fatty deposits, can be filled with cholesterol, but it will narrow the lumen or the opening of the blood vessel. When you completely block the coronary artery, the heart will not get enough blood flow.
Keeping the heart happy is simple. By following a few basic lifestyle choices, everyone can improve the function of their heart.
The American Heart Association recommends 7 steps that you can take to prevent development of coronary artery disease. The 7 things that you can do for yourself include: number 1, to stop smoking; number 2, to eat a healthy diet, and that includes a lot of fruits and vegetables; number 3, to lose weight and get into your ideal body weight range; number 4 would be to exercise at least 30 minutes a day and as many days of the week as you can, but a minimum of 30. 5th, you should have your blood pressure checked regularly and make sure those numbers are appropriate. 6, you should make sure that your fasting sugar is normal, and if not, if you are diagnosed with diabetes, then you should make sure that your numbers are controlled. And lastly would be to check on your cholesterol, make sure your numbers are appropriate. If you are diagnosed with elevated cholesterol and you're treated for that, to make sure your numbers are in control.
Making the choice to follow life's simple 7 is a great step to take. Your heart will thank you, and the benefits of a healthy lifestyle are an added bonus. The small choices that face us every day make a big difference. Eating well, getting enough sleep, managing stress, and maintaining overall health ensure the heart and whole body stay strong.